First of all, may I use this video for educational purpose and on the internet, please?
Yeah.
Absolutely. Thank you. Now, let me just turning here. You had have a severe scoliosis, and the cup angle is 31 degree. As well, it's important. This is a CT, meaning you are laying down and straightening it somewhat. So if you get a regular scoliosis picture, probably that scoliosis is even much worse. Now, first of all, how long did you have symptoms before the surgery?
I've been suffering for quite a while, and I remember my granddaughter turned 5, and she's now 9.
Okay.
So then it got worse, and then I had to
So
start.
for many
pain
years.
medicine. Yes, many years.
And what did doctors offer you? What did they tell you what you should do?
Well, quite frankly, most doctors just kind of send me away.
Okay.
And then I was put on some hydrocodone and some medicine for pain, and that seemed to help. And I was working full time out of the home. I had 2
you were on narcotic, right?
and I had 2 foster adults in my home, and I had to take care of the home. I had no help, so I did all that and still suffered with the pain.
Now, many doctors do send people away with a problem like that because the surgery for that is a big surgery. This scoliosis surgery is a big surgery and very risky.
I never heard the scoliosis until I saw Dr. Savannah and you.
Okay, but now you have a scoliosis, and your scoliosis is not a little, it's significant, and multiple disc disease. Now, we did the surgery just about 2 weeks ago, is that right?
2 weeks and a day.
Okay, and as well, many people say if you do a surgery like that, you cannot open up and get rid of the pressure on the nerve. But I think your example that this is absolutely possible. Tell me, how was the pain after the surgery?
My right leg has finally not hurting from the inside all the way up my leg.
So the pain in the legs, what we call radiculopathy, was gone. When did it go away?
She said when she woke up from the surgery, that leg was alive.
The first visit I had from you was like that I remember was the evening you came in after the surgery, and I told you I didn't feel that pain in my leg anymore. So that pain is gone. Yeah, it's.
And the reason for that pain is gone is we are going to look here. Is that first of all, we correct that scoliosis and we measured that was in the CT 31 degree, now it's 5 degree. The difference is that when you, in this picture, when you stand up, that 1 degree get worse. But here we have screws in place, that 5 degree does not get worse. So this is permanent. So amount of the correction is actually more than 31 to 5.
Okay.
But as well, we see that in your case, I put many of those screws by what we call bicortical, going from one bone to another, because you have a little softer bones. But we could correct the scoliosis with the spacers that we put in strategic location. And we took the pressure off, and that's why the pain in the leg is gone. Obviously,
I feel like the pressure's off. I haven't felt that same pain.
Yeah.
And that has given me a lot more relief than I normally expected in my legs.
Yeah. Now, obviously, it would be unusual not to have pain just 1 week after the surgery. But overall, how much of the pain do you think it's gone? Or
I think I'm feeling more of the actual surgery itself pain because the nerves in my hips and my lower back feel like they're mostly from the surgery.
Okay.
I don't feel if I could move and bend like I should be able at some point. You know, I didn't need the rest or I had pain. I think it would be. I think it's gotten way better.
Wonderful, wonderful. Now I'm going to move again and show you in the 3D how those hardwares are. So we put 4 cages and 10 screws, all with small holes with minimally invasively. And practically this surgery in an open old-fashioned way would have been easily an 8 or 9 hour surgery. Our surgery just was less than 2 hours. It was 1 hour and 40 minutes actually, and our blood loss was barely 100 cc or so. So, and this, you are the proof that this kind of surgery can be done. We actually published a paper about it just recently, and I'm going to be internationally going to Istanbul talking about this and teaching it to other surgeons. Overall, do you think the surgery so far has helped you?
Yeah.
Excellent, excellent. Thank you for the interview.
Can't wait for the rest of the healing process.
Absolutely, absolutely. Thank you.